get as many of those suckers as possible, but there might be one or two lingering that they can't find. I have been disease-free since surgery, but I will always be stage 4, because after that number ranking, they never downstage you. That's your number for life. I still see my oncologist every 3 months, still get blood work and scans 3 to 4 times a year, and will be on hormone therapy for the rest of my life. After about 2 years on the trial chemo drug, my oncologist took me off it. It had done its job, and the doctor feared that long-term use could cause another secondary type of cancer. With that one phone call from Dr. Kelly in November 2012, I suddenly entered a world that I had always studiously ignored, the medical world. I hate to have my teeth cleaned, much less sit in paper gowns in waiting rooms and bear all. I used to be so terrified of doctors that I'd break into hives across my chest, causing the doctors to immediately test for allergies. I didn't feel like myself for a couple of months before I went to my GP, general practitioner. I blamed it on being a tired mom. I felt pain in the left side of my chest and noticed some changes in my left breast, and after a round of antibiotics was ineffective, my doctor referred me to a breast surgeon. At no point did I think it could be cancer. Everyone kept saying, "Cancer doesn't hurt." I barely got to the breast surgeon for a diagnosis. I tried to put off the appointment so I could help cook that year's Thanksgiving dinner. Dr. Kelly called me the morning after Thanksgiving at 7 a.m. to deliver the news. She told me she didn't like to do it over the phone, but she was in Georgia, and could I please sit down? Within 1 hour of that phone call, my husband and I were driving to the hospital so I could be admitted for tests and immediate treatment. I was so sick so quickly that much of it occurred in a blur. Before I was diagnosed, I didn't even know there were types of breast cancer, or even grades of cancer. I was completely, blissfully oblivious to the world of cancer, other than the snippets I had heard, read, or seen on television. I started taking notes in a journal on my laptop, writing down my fears and frustrations when I could, especially during the wicked bouts of insomnia created by chemotherapy, and my sister and husband took detailed notes at every appointment. But what I craved, besides icy cold lemonade, was honesty. There are a lot of whispers and pained looks that surround a cancer diagnosis, and there is a lot of silence. In those first months, I talked to nurses and doctors and X-ray technicians and survivors, but what I didn't hear was anything particularly helpful regarding the day-to-day stuff. I wanted to hear, or to read, what was really going to happen. What will it feel like to get a needle stuck in my armpit? What will I say to my kids when they ask what happened to my hair? What could I eat? What would chemo feel like? What would radiation do to my skin? What would I look like without breasts? I love nothing more than a plan and a list, and neither was in sight. I remember so clearly sitting on an exam room table speaking to a radiation oncologist at the MD Anderson Cancer Center in Houston. We were there to get a second opinion, and she looked at me and said, "This fucking sucks. It's okay to cry and say it. Forget the pink warriors. You have cancer, and it sucks." And that was what I craved, to hear someone say something honest about what was happening. I felt so alone and so isolated, and the only thing I wanted was answers. Books had come to my aid during pregnancy, before job interviews, when I needed to learn a language. My whole life, I turned to books for answers. Why not this? The best I could find during the initial steps of my diagnosis were somber hospital brochures titled "Coping with Cancer," filled with photos of half-smiling patients and their caregivers drinking tea. I needed something else, something honest, and at times funny, something real and usable, but also a companion, a friendly voice in your ear on a bad day, something that points out the absurdity of your new normal, something that addresses the grim specifics that everyone else seems to gloss over.